Hello and welcome to a new episode of Science in Context. I'm Ryan and this week I'm speaking to Monica DeCola about measuring the impact of malaria interventions. Monica, how do we know whether new interventions are working like they're designed to?
New interventions like drugs and vaccines for malaria or any disease are tested early on in controlled clinical trials to show if they work. Outside of trials, their effectiveness can be impacted by numerous factors, such as how well or how widely they're used, or drug resistance among the pathogen. So it's important to measure effectiveness in the real-world setting. For this, we rely heavily on routine sources, such as data collected by local clinics on the number of cases they're seeing.
And what are the challenges in using these routine data sources?
These sources are large, detailed national-level data sets which are incredibly valuable, but there are multiple confounding factors which can affect data quality. For example, if we see an increase in malaria cases while running a control program, it could be because the intervention isn't working, but equally it could be that something has changed, such as more healthcare centers or better diagnostic tests, so the clinics detect more cases than they would have previously. Our work tries to adjust for this by calibrating a mathematical model so we can better understand those factors and more accurately measure the real impact interventions are having.
And how does this help for malaria or other infectious diseases?
Our approach has so far focused on programs in Burkina Faso and Nigeria to prevent malaria in children. At first, the data were concerning because overall malaria cases were increasing, but our modeling has shown that increase was very likely just better detection of cases, and that the medications were indeed having a significant impact on prevalence of malaria in children. We hope these methods could improve how we measure the real-world impact of new interventions. Beyond this, it could help us to better estimate the global burden of disease.
Monica, thank you for your time.
Thank you.